Hi, my name's Edwina Holmes and I'm a nurse educator here at MQ Health. Today I'm going to take you on a journey through health literacy and how healthcare providers and patients can collaborate in care. Imagine you are sitting in a doctor's office and they start explaining your diagnosis using medical jargon. You nod along and smile, but inside you're confused. You leave with a prescription, but no real understanding of what's wrong or how to manage it. Does this sound familiar? This is a problem of health literacy. And today, I want to discuss what health literacy is, why it is so important, and what we can all do, both patients and healthcare providers, to improve it. Health literacy is the ability to find, understand, and use health information to make informed decisions. It's not just about being able to read a prescription or understand a pamphlet. It's about navigating the complex healthcare system, knowing when to seek medical attention, and actively participating in your care. However, studies show that up to 60% of adults struggle with health literacy. This isn't just a problem for individuals, it affects families, communities, and the healthcare system as a whole. So why is health literacy so important? Poor health literacy leads to higher rates of hospitalisation, medication errors, and difficulty managing chronic conditions. It can mean the difference between catching an illness early or facing severe complications. But when patients understand their health, they are more likely to follow treatment plans, attend follow-ups, and engage in preventative care. In short, better health literacy leads to better health outcomes. So what can we do to improve health literacy? If you are a patient, there are several effective strategies you can use to improve your health literacy. Asking questions. Never leave a medical appointment feeling unsure. Ask for clarification. A great phrase to use is, "Can you explain that to me in a way that I will understand?" Using the teach-back method. The teach-back method is a conversational tool for helping patients understand important information. It involves repeating the information back to your healthcare provider to confirm that you have understood the information correctly. This provides an opportunity to clear up any misunderstandings in the moment. Look for reliable sources. Not all health information online is accurate. Stick to reputable sources like government health websites and MQ Health. Bring a support person to your appointments. A second set of ears can help catch details you may miss. And follow up. If you still need clarification or if you have more questions after you leave an appointment, call back or schedule another visit. So what are we doing here at MQ Health to improve health literacy? At MQ Health, our staff are educated on health literacy to ensure that they can effectively communicate with our patients and provide the best possible care. Some ways in which we are improving health literacy include providing clear communication. We train our staff to avoid jargon and explain concepts in simple everyday language. We use the teach-back method as well. Our clinicians ask patients to repeat key information back to ensure that they have an understanding. While this may seem repetitive, it's a great tool for assisting both healthcare providers and patients in reducing misinformation. Encouraging questions. We create a safe environment where patients feel comfortable asking questions. You can pretty much ask anything. The readability standards. We assess the readability of written health materials to ensure that there is access to all literacy levels. And follow-up care. Our healthcare providers are available to help clarify information and enforce key messaging. If you are unsure of the message or the information, please reach out to our teams who will assist you in navigating your healthcare concerns. And the co-designing of health information. MQ Health has an established Consumer Advisory Committee who are involved in creating and reviewing health-related materials to ensure that they are relevant and useful to our patients and our communities. Health literacy is not just a skill, it's a right. It's about empowering people to take control of their health, whether you're a patient, a caregiver, or a healthcare provider. We all have a role to play in making health information clear and accessible. At MQ Health, we believe that informed patients make better health communities. So let's work together to ensure that no one leaves the healthcare environment confused or uncertain. Because when people understand their health, they can change their lives.